How to lower high ferritin levels. That's what we're going to talk about today. My name is Dr. Tom Rofrano from the Natural Medicine Clinic in Palm Beach Gardens, Florida. And I've had the opportunity to see over 100,000 patient visits over the last 36 years, many of whom have thyroid and gut issues, and high ferritin level is a common thing that I see. So step number one, what is causing high ferritin? Is it the very common insulin resistance, prediabetes, fatty liver, excess alcohol consumption? Is it in that category, or is it from iron overload, consuming too much iron, repeated blood transfusions, or hemochromatosis, which is a genetic disorder? Or is it from other causes of inflammation, liver disease, cancer, infection? The minimum blood test I recommend besides ferritin is serum iron percent saturation, TIBC, CBC, chemistry panel, CRP, GGT, LDH, lipids, thyroid markers, TSH, free T4, free T3, uric acid, insulin, and A1C. If your iron saturation is high along with iron, you can also get some genetic markers for hemochromatosis. This is all outlined in my book, The Free Diet. I have a chapter on ferritin. That would be the minimum test. I also do additional functional testing to determine deficiencies, toxins, infections, food reactions, and hormonal imbalance. To get a more complete picture, the ones I mentioned would be the minimum what you want to find out to start determining the root cause. And once that happens, you can then go to work on how to lower it, which is step number two, diet. The diet that I developed is called the Free Diet. It's free of gluten, grains, sugar, yeast, dairy, eggs, soy, legumes, nightshades, processed foods, all those foods most commonly responsible for inflammation, gut, and other chronic health issues. I've had a lot of success in helping patients with elevated ferritin levels, whether it's due to insulin resistance, iron overload, other inflammatory causes. I have a link below if you'd like a copy of the Free Diet Phase 1. Along with that, there's a shopping list that we provide and how to get started on that. I had a patient recently whose ferritin levels were 1,400 before he came to see me. He had been eating a diet high in junk food, a lot of takeout, put on 20 pounds, wasn't exercising. He was only 33 years old and levels went up to 1,400, high lipids, high inflammatory markers, fatty liver. He spent 6 months improving his diet and exercising, lost a bunch of weight. When he came to see me, he was still at around 700. His ferritin was stuck there. So did an evaluation, found out some other things that were going on, put him on the Free Diet, along with some supplements, which we'll go over. And levels 3 months later, down into the low 300s. And that was from 1,400 6 months prior, before he came to see me. And all of his symptoms cleared up. He was feeling good again. Not to mention, his testosterone was 186 when he came to see me. And 3 months later, 550, 186 to 550. That's without taking any testosterone replacement, simply with the Free Diet, the supplements that we had him on. So number three, supplements. Which ones? Well, I start with the functional 5, which is multi, fish oil, vitamin D, magnesium, probiotic. I'll list those below so you have those. And then also use curcumin, liver support. If there is iron overload, then metal cleanse. Also, infrared sauna is helpful for iron overload. And should you donate blood or not, if someone has iron overload and their hemoglobin, hematocrit, RBCs are high enough so that they can donate blood, yes, that can be helpful. It typically can lower ferritin about 30 points for each pint of blood. You can only do it so much though, because then you can become anemic. So, number one, get the proper testing. 2, follow a good anti-inflammatory diet like the free diet. 3, proper supplements, and that should help tremendously. Just like this patient who was at 1400, brought his ferritin down to low 300s. You just have to find out what is causing the high ferritin, then be provided the proper solutions, and I believe most everyone can get better. Thanks for joining me today. Feel free to like and subscribe below, and look forward to seeing you next time. Take care.